having white spots on your teeth? If you do, what do they tell you? Hi everyone, welcome back to my channel. Today we are going to take up a very important topic which most of you will not notice in the beginning stages. So, they are the white spots. I'm sure that brown spots is something which all of you must have seen. But white spots? Just look at your teeth carefully. I think you will find them. Let's take the simplest of the reason, that is poor oral hygiene. So if you are a person who is wearing braces, then you must have noticed that you see these white spots around the braces where once you remove them, it becomes more evident. So what is happening there? You are not maintaining your oral hygiene in a good way. You are not brushing well, the plaque buildups in that area, the bacteria which are present there, they all lead to these white spot lesions and these areas become more prone for decay. So make sure that if you are wearing braces, still you need to brush and keep the area very clean. The second most common reason would be demineralization. It just means that in that particular area, the mineral content of the enamel is slightly different from the other areas of the tooth. It appears as chalky white areas on the tooth surface. So these areas, they are very prone for decay and you generally will not notice it. Actually, demineralization will be seen before they start for decay. So whenever the decay has started and you see a stain or a blackish discoloration of the area, you feel that that's the day when the decay has started. But no, the demineralization will be the initial step which will go missed by you all. So whenever there is a demineralization, you're able to notice it. The advantage is that at this stage, the condition is reversible. I wouldn't say reversible that this white spot is going to turn back to normalcy, but what you can do at this stage is using a fluoride toothpaste will help in remineralization and making that area strong. Fluoride will incorporate into the enamel and make that area resistant to decay. So finding out white spot in the very initial stages, if it can be on the top surface somewhere, sometimes it's on the top surfaces or the chewing surface of the teeth, sometimes it's seen around the gum line. So in these cases, if you're able to notice it and identify it in the beginning, you can start using a fluoride toothpaste. I'm sure that you can even take a consultation with your dentist in the very initial stages if you're able to find it out. The third cause. That is because of having a condition called dry mouth or xerostomia. Now there can be n number of causes for having this condition, but if you know what's the cause, then the first treatment protocol that you should be doing is find out the cause and eliminate that. So during dry mouth, what happens is you'll be having a reduced salivary secretion, thereby the cleansing action reduces, thereby the mineral content of the saliva which will be available for the teeth will reduce, and ultimately demineralization of the tooth becomes much faster. So if you're able to identify what is the cause for xerostomia or dry mouth, then you need to treat it accordingly, and a patient with such a condition should always look out for white spots in their mouth. Other than these three reasons, there are two more reasons which is generally, in case of the first three reasons, what we see is the white spots will appear as you age. You will not start noticing it suddenly. But during childhood itself, if you are starting to notice white spot lesions on your tooth, then it can be either because of enamel hypoplasia or it can be because of a condition called fluorosis. So enamel hypoplasia is a congenital condition. It can be happening because of any lack of mineralization, that is improper mineralization during the development of tooth, because of any illness associated with the child. It can be genetic, it can be because of a disease which the mother of the child had, it can be associated with certain syndromes. So whenever that is there, the enamel that is formed in general will be weak. So these patients are more prone for decay, but what you see here is it will not be a very nice tooth with just a white spot in one place. Most of the time, the enamel, in case of an enamel hypoplasia, will be soft, friable enamel, not like what we have when you have an ortho treatment or when you have a dry mouth. So you will start noticing it since childhood. And what you need to, actually it's a condition where you cannot do anything about it. Maybe what you can do is have a good checkup, and even at the earliest of the stages where you can have a small decay, you can prevent decay, you can give good conditioning for the tooth so that it will last longer. The next one is fluorosis. So fluorosis, even in that case, the enamel is not going to be glossy and smooth like how it will be in case of other, when your teeth is good shape. But in case of enamel hypoplasia and fluorosis, the teeth is not going to be glossy and shiny and very smooth in its texture. So fluorosis, it can happen because of ingestion of extra fluoride. You should remember that I told you realization is there, you use a fluoride toothpaste. It's like a prevention at that time, but anything in excess is harmful. So fluoride in excess is also very harmful. So does that mean that you take a toothpaste, you eat the entire paste, you're going to get fluorosis? It might happen, but that's very rare. But what happens here most of the time would be that ingestion of fluoride in the water that is what you're consuming most of the time from the soil, the fluoride content is so high that during your developmental stages you are going to ingest it. So when your tooth is developed, your bones are developing, the fluoride will be very high amount which is actually being introduced into the body. So at that stage, we develop what is called as dental fluorosis, which is in turn is going to have this chalky, opaque and whitish areas on the tooth. Mostly it will be affecting a more number of teeth depending on at what stage you were in that place. Don't think that just because you are consuming one glass of water or once in a while, if you are consuming this fluoride increase in the water, it's not going to happen. This will happen if you are in that place for a prolonged period of time and you're consuming that. So if you're having fluorosis, definitely do consider visiting your dentist. Try to take all the precautions knowing that your tooth will be, the advantage is that the tooth will be slightly more resistant to decay, but the enamel quality will be very less, and the appearance will not be good. So you can take different kind of treatment based on what type of fluorosis and how much of your teeth is affected because of fluorosis. In all the other cases, do visit your dentist. If you notice a white spot, please do inform them that this is present. They will most probably advise you to have a fluoride-rich toothpaste, or if any treatment is required, they are the best ones who can tell you what needs to be done. All this can be told by only your personal dental practitioner who knows you. So please do take care and please like, share and subscribe. Thank you.